Facebook friends. Welcome to another episode of Get Healthy with Dr. Cooper. We have been enjoying the various topics over the last several weeks. I've been enjoying your comments, and today I want to welcome all of our viewers from around the world as well as from United States of America. Today our topic will be hypertension, the silent killer. Now, do you know your blood pressure? When was the last time you went to the doctor and had your blood pressure checked? High blood pressure or hypertension is one of the leading causes of many complications, such as heart disease, stroke, and death. Now, blood pressure is the force that is exerted between the walls of the blood pressure of the blood vessels. That pressure is dependent on the work of the heart as well as the resistance in the blood vessel. There are usually two numbers. One is the systolic blood pressure. The systolic blood pressure is measured when the heart pumps blood. When the heart relaxes, then we have the diastolic blood pressure. That's the one at the bottom. Now, what is high blood pressure? What is hypertension? Now, if the blood pressure is 140 over 90 and above, then that is broadly described as high blood pressure. Now, in the United States, it's estimated that 85 million people have high blood pressure. High blood pressure or hypertension is a global health concern because as we change from a healthy lifestyle to an unhealthy lifestyle, then we tend to increase the blood pressure. Now, what are the ranges? I gave you a broad definition for hypertension, but let's look at what is a normal blood pressure, what is pre-hypertension, what is stage 1, and so forth. Now, if the blood pressure is about 120 over 80, that is regarded as normal. Now, blood pressure is usually a range. Now, pre-hypertension is anything between 121 to 139 over 80 to 90. That is regarded as pre-hypertension. And stage 1 hypertension is the blood pressure of 140 to 159 over 90 to 99. And then as the blood pressure increases, then also the stage increases. Now, we have something that we call a state that is called hypertensive crisis. There is a crisis when the blood pressure is severely high. 180 over 110, that is called hypertensive crisis. Now, usually if you were to go to your doctor and you walk into the office and you're hurrying along, then sometimes that can cause you to have an abnormally high blood pressure. Usually in the doctor's office, the patient is asked to sit and wait for about 5 minutes, and then the blood pressure is repeated. Now, why is hypertension called the silent killer? Silent. It means that many people or most people with hypertension do not have symptoms. You don't have headache. Most times there is no chest pain or shortness of breath. One doesn't lose weight. Now, if the blood pressure reaches a very high level, hypertensive crisis, then that patient might experience headache or nosebleed. Nosebleed because the small vessels of the nose might rupture under the pressure, and then that could lead to nosebleed. Now, there are two types of hypertension, we say. One is called primary hypertension and secondary hypertension. Usually, primary or essential hypertension has no true etiology, no true cause. We might not be able to identify a cause for the hypertension. Now, secondary hypertension, usually there is a cause, whether the patient has a particular drug that is causing the high blood pressure, or the patient has renal failure, or a syndrome called Cushing's syndrome, or pregnancy, but there is a cause that is contributing to the elevated blood pressure. Now, there's certain stressors that we call it that could cause hypertension or high blood pressure. For example, certain common drugs that a patient might be on for a prolonged period of time, like steroid, prednisone. Prednisone sometimes is given for, for asthma or for other lung diseases or various diseases. The steroid can cause hypertension. There's some common drugs that are on the market for pain: Motrin, Advil, naproxen, Aleve. These drugs over time can cause high blood pressure. And if the patient already has high blood pressure and is on these drugs, then these drugs can worsen the blood pressure. A diet that is high in salt, high in sodium, can also elevate the blood pressure. Why is that so? Sodium will cause the body to uptake fluid into the bloodstream, and that can lead to fluid overload and hypertension. And usually a diet low in sodium is recommended. The daily amount of salt or sodium in the diet should not be more than 9 to 12 grams. Now, high blood pressure, as I said, is a silent killer. What are some of the long-term complications of high blood pressure? And as I mentioned, atherosclerosis, hardening of the blood vessels. The blood vessel become hardened, there is not enough room for expansion, and this can worsen the hypertension. This can also lead to more work on the heart and therefore pump failure. Now, there's also the risk of heart attack, and there's a risk of the patient developing what we call aneurysm. So the blood vessel becomes stiff, and therefore there might be weakening in the wall and pocketing or ballooning of the blood vessel. That is called an aneurysm, and that can be dangerous if the aneurysm is ruptured, especially if it's in the chest, if it's in the brain. That can cause severe bleeding and death. Other complications are like renal failure. There are a lot of patients who have had high blood pressure over time. The blood pressure is not controlled well, and that puts strain on the kidneys. Patients end up with renal failure and the need for dialysis. And as I mentioned also, one of the complications for high blood pressure is stroke. Another complication might be poor circulation and amputation. High blood pressure can also affect the eyes and cause to blindness. So high blood pressure is a disease that you do not want to have. And as I mentioned before, that usually there are not many symptoms for high blood pressure, and that is why it's called the silent killer. How do you then know if you have high blood pressure? Then you need to make sure that you're seeing your doctor on a regular basis. If you're healthy, make sure you have a yearly physical examination with your doctor, so then you could have your blood pressure checked. Also, in many pharmacies, you can just walk into the pharmacy and get your blood pressure checked. So if you're listening to me now, I'd like you to ensure that you are taking control of your health. Remember, the main focus of my program is to educate, empower, and encourage you to take control of your health so you can change your healthcare destiny. I have done a recent program on my TV show on hypertension, and I'm going to be showing various excerpts from this program. So this time I'd like you to sit and listen to various ways in which you can reverse hypertension naturally. And if you do not have hypertension, following these steps could assist you to prevent hypertension. Let's listen to steps to reverse hypertension naturally. The first video. This program is designed to educate you, the viewers, on various lifestyle diseases by providing you with information on how to use lifestyle modifications to reduce, improve, prevent, or even reverse chronic illnesses. Our topic today is getting rid of hypertension without medications. High blood pressure is broadly defined as having blood pressure of 140/90 or greater. High blood pressure or hypertension is one of the risk factors for early death. But you do not have to die early as a result of hypertension. You have a choice in using healthy lifestyle to prevent, delay, or treat hypertension. So here are some simple modifications that you may use. Number 1, lose the extra pounds. Obesity is one of the major risk factors for many diseases such as hypertension and heart disease. It is said that losing 10 to 15 pounds can reduce your risk of high blood pressure. Losing weight is one of the most effective lifestyle changes for controlling blood pressure. Number 2, eating a healthy diet. This includes more fruits and vegetables, whole grains, low-fat dairy products, low saturated fat, and total fat. This is called the DASH diet, dietary approach to stopping hypertension. Fruits and vegetables are high in potassium, which is believed to lower blood pressure. Number 3, reduce the amount of sodium in your diet. You should not consume more than 1 teaspoon or 2,300 milligrams of sodium daily. So learn to read the labels and choose those food items low in sodium. It is a well-known fact that consuming too much salt may increase blood pressure. Number 4, get regular aerobic exercise for at least 30 minutes a day. You may begin by walking briskly daily for at least 6 days a week. It is believed that walking 30 minutes a day will lower blood pressure by 4 to 9 points. So if you are pre-hypertensive, regular exercise will help you avoid developing high blood pressure. And if you already have high blood pressure, then you can lower your blood pressure by becoming physically active. Number 5, quit smoking. Smoking may increase your blood pressure and also may have other negative effects on your health. So getting rid of this habit will increase life expectancy. And number 6, limit the consumption of alcohol. Even though some people believe that a small amount of alcohol is good for health, it may be difficult to determine what amount gives you any health benefit at all. So in general, I recommend that we stay away from alcohol. Not consuming alcohol will lower your blood pressure. Number 7, avoid caffeine. Even though the role of caffeine and blood pressure is still unclear, it is believed that caffeine is a stimulant and may increase blood pressure by several points. Number 8, reduce your stress. It is believed that stress increases the level of certain hormones such as adrenaline and cortisol in the blood, and this may promote higher blood pressure levels for those individuals who are stressed. Reducing stress will decrease blood pressure by several points. We will have more information for you on how to live a healthy lifestyle and how to treat hypertension without medication after this short break. So there you have it, Facebook friends. There are many ways to reduce your blood pressure or to prevent hypertension by doing it naturally. There I mentioned food, I mentioned salt, I mentioned alcohol, coffee. One of the main factors that can lead to high blood pressure over time is stress. And I'm sure many of you out there have stressors in your lives. But with stress, what the body does, the body puts you in a state of action. So there are certain hormones, adrenaline, that is reduced with, increase with stress. This causes the heart to pump faster, the blood pressure gets high, the patient might be in a state of tachycardia. If the patient continues to be in a recurring state of stress, a chronic state of stress, then that will cause high blood pressure. So one of the ways to reverse hypertension naturally is to find ways to manage your stress. Relaxation, meditation, distraction, detachment from the stressors. I know that usually people might be in a high-stress life, high-stress job, but you need to make sure that when you get home, you detach. You leave the stress at work and come home and relax. Now, the number one treatment for high blood pressure really is lifestyle adjustment, lifestyle modification. Now, I'm sure that there are many drugs that we as physicians prescribe for hypertension. But in order to really treat the problem, we need to get to the root. What is the cause of that hypertension? If the hypertension is primary, no real cause, then a lot of time patient needs medication. If the hypertension is secondary, meaning therefore there might be a drug, there might be a tumor, there might be elevated hormone, then we fix that problem. But most patients, 90% of patients, have what we call primary hypertension or essential hypertension. And that's the hypertension that we can use lifestyle to actually reduce the blood pressure. Now, as you know, I like to emphasize food as medicine. And did you know that there are many fruits and vegetables that have various diuretic, behave as medication that we call diuretics. Diuretics are medication that we give to patients to decrease blood volume and therefore decrease blood pressure. So what are those fruits? Now, many fruits and many vegetables. For example, watermelon, grapes, celery, carrots, eggplant. All these are fruits and vegetables that can actually reduce your blood pressure. Now, there are other fruits and vegetables. For example, leafy green vegetables. Leafy green vegetables are high in potassium, high in magnesium. Magnesium will help to relax the blood vessel wall and therefore decrease the blood pressure. Now, potassium has the reverse effect as sodium. Potassium will decrease the blood pressure while sodium will increase the blood pressure. Now, legumes, peas and beans have a high concentration of potassium, magnesium, fiber, calcium, and low in sodium. So consumption of these food will tend to decrease your blood pressure. What about celery? I know that many of my patients like to talk about celery. Celery has what we call a vasodilatory effect. Celery will increase the production of nitric acid or nitric oxide. This will dilate the blood vessel and therefore decrease the blood pressure. Now, have you heard of nitroglycerin? Nitroglycerin is a pill that we give to the patient, whether in pill form or IV, to open the blood vessels and therefore lower the blood pressure or increase the flow of blood to the heart in the case of chest pain. While celery and some other vegetables and fruits will increase the natural production of nitric oxide, and that will lower the blood pressure. Now, squash, do you like to consume squash? Squash is rich in potassium and low in sodium. So consuming squash will also assist you to lower your blood pressure. Now, there's a lot of information out there on garlic, the use of garlic. Now, consumption of garlic will also assist in lowering the blood pressure because garlic also has a vasodilatory effect. So consuming garlic in the right amount will open the blood vessel. Opening the blood vessel will then lower the blood pressure. Because remember, I told you that pressure is dependent on the resistance to flow in the blood vessels as well as the function of the heart. So if the blood vessel is stiff, that means or rigid, then the blood vessel will have difficulty opening. And if the blood vessels are unable to open or to dilate, then the pressure will be built up and the pressure will be high. Grapefruits and pears, these are also very, very good for lowering the blood pressure. So if you're listening to me and you have hypertension, then remember, consuming a plant-based diet will increase the possibility of lowering your blood pressure so you can live a longer, happier, and healthier life. Now, I want to take the time to welcome my friends online. There's several of you. I want to welcome you. I have a lot of new friends from Impact 77. I just want to welcome you, Pastor John, and all of my friends, new friends and old friends. Remember to share this video. Remember to like the page, share the video so that more people can receive benefit from this information. Remember, the focus is educating, empowering, and helping you to live a longer, happier, and healthier life. At this time, I'm going to take you to a cooking video. Here we're going to be making hummus. Hummus is a Middle Eastern food that is made from chickpea. Very delicious. You can use it at home as a dip. Let's listen to the recipe. In our kitchen today, I have Liz, a dietitian, and Maribel, a health coach.
Hi.
Liz, what do you have for us today?
Today in the kitchen, we're making hummus or chickpea dip.
Good,
Another way to
Maribel.
think of it.
Well, I want to make sure everybody knows we have an option. We can cook our own garbanzos at home or we can buy them in a can. Just make sure you rinse them. If you decide to cook them, make sure you soak them overnight.
What is hummus, by the way?
What is hummus? People know it by garbanzos. People know it by chickpeas. But what we're making is a dip. And instead of a bean dip, we're making our garbanzo dip.
Good, and hummus is used in Mediterranean diet. Very healthy, so watch with us today.
We're going to start by adding our parsley, and you can use your blender. It doesn't have to be any specific blender. And then we're going to put the parsley on the bottom to start the process and make sure it gets finely chopped. We're adding 2 cups of cooked garbanzos.
And the best thing about the garbanzos are that it's the best form of legumes for diabetics
Very good.
to control their blood
High in
sugars.
protein and high in fiber.
That
Very
is
good.
correct. We're going to proceed by adding our fire roasted bell peppers and onions.
Very good, and that's going to give it a fantastic flavor, am I right?
That is correct. Don't forget, one of our other ingredients is tahini.
Well, what is tahini, by the way? We've used it before. What's tahini?
Sesame seed butter.
Sesame seed butter, and sesame seed is filled with a lot of good fats and omega-3 fatty acid.
And vitamin E.
And vitamin E for the skin. So don't forget this tahini.
And last, we're going to add our garlic powder.
Very good. And you know, garlic is good for the immune system, so eating garlic is good for your health. All right. Good. All right, let's see. Very good. Let's see. I like the color, so that means
Depending on the consistency that you like, you can add, if you want it thinner, you can add a little bit more of water. And last, we're going to add our lemon. Add the lemon, the little bit of fluids, and blend it.
very nice. We're getting there.
Almost done.
Almost done.
The best thing about this recipe is the versatility you can have with the hummus. You could not only just have the red bell pepper, but you could have green or whatever flavor you like.
Very good, and it can be used as a spread as well. So let's go ahead and see how you're going to use this. Very nice, ladies. Let's see. So you're going to use it as a dip to dip those vegetables you have there. Am I right?
Yes.
Correct.
It's
And
like
we
the
have-
best incentive to have our vegetables.
Very
Sometimes
good.
it's difficult for us to get them in our diets, but this is a great way.
Good, and
have
we're
them.
using multicolored vegetable. Remember that the color of the vegetable bring various vitamins and minerals. So when you're using vegetable, you need to mix the colors. Very nice. Yep. So here we have, you can have this if you're having a party or any special event. And then we could use it with your pita chips. And remember to get whole grain pita chip, because this is unpolished and not refined. So you have all the vitamins and all the fiber here.
Never fried, always oven cooked.
Very good. For more recipes, visit our website, gethealthywithdrcooper.tv. All right, Facebook friends, that is indeed delicious. It's hummus. And as I mentioned, you could use the hummus as a dip. So if you're having a party and you have your friends who are not yet vegetarian, that's a great dish to have on your table. And with the hummus, you could serve that with the vegetable stick. You could serve with the pita chip. You could serve it as a spread for sandwiches. You could use it in a wrap. You could get, whether you get a tortilla or you could use lettuce wrap, put the hummus there, put your vegetable wrap. That is a complete dish. You must realize that many years ago, Hippocrates, the father of medicine, said, let food be your medicine and your medicine be your food. And you realize that many of these fruits and vegetables have medicinal properties. I just mentioned those fruits and vegetables that have diuretic properties. Diuretics are drugs that we give to decrease blood volume. If the patient is swollen, the patient has high blood pressure, we give these drugs so the patient could urinate. So we decrease the blood volume and we increase the urine volume. So that will lower blood pressure. Then I discussed fruits and vegetables that are high in potassium. Potassium will also decrease the blood pressure. Fruits and vegetables are low in sodium, decrease the blood pressure. Now, hibiscus. I'm sure that if you're from the Caribbean or if you're from Africa or Mexico, you know of the hibiscus plant or sorrel. The sorrel, having one glass of sorrel tea per day, can be as effective as certain medication that we call ACE inhibitors, benazepril, lotensin. These pills that we prescribe, you can have the same benefit from drinking the hibiscus tea. So your food can indeed be your medicine. I've had several patients who have decided to use a plant-based diet in their lifestyle changes. And many of them have gotten off blood pressure medication. Many of them have decreased the number of medications they have taken. If you're listening and you're thinking, how do I do this? Remember that I've been mentioning to you that I have 3 books on the market. One is called Get Healthy for Life. There I've laid out various principles for you to follow in order for you to change lifestyle and have healthier outcomes. Then I have 14 Days to Amazing Health. 14 days take you through a step-by-step approach to transition you from unhealthy lifestyle to a healthier lifestyle. In that book, I have over 100 plant-based recipes. I have an exercise section that you can follow. I have a section in which I ask you to meditate and forgive, and this can promote stress management and healthier lifestyle. And then the last book is just a cookbook. It's incredibly delicious vegan with very, very delicious recipes. Find all of those online. You can go to my website, drdonacooper.com, DRDONACOOPER.com, for all those resources, and use them. Use them as my patients have done. I've lost weight, have changed lifestyle, have gotten off medication, and are enjoying better quality of life. Now, I have a friend, Dr. Andrew Levine. He is a nephrologist. He sees a lot of patients with hypertension and then kidney failure, one of the complications. So this time, let's listen to what he has to say about high blood pressure. Welcome back. Today we have been talking about high blood pressure. And in our studio today, I have Dr. Andrew Levine. Dr. Levine is a nephrologist. He sees a lot of patients with hypertension and kidney failure. Welcome, Dr. Levine.
Well, thank you very much for inviting me.
You're welcome.
To participate in this event.
Good, good. Dr. Levine, what is hypertension? What is high blood pressure?
Well, to understand high blood pressure or hypertension, as we call it in the medical term, we need to understand what blood pressure is.
Right.
There are a couple of organs that participate in maintaining pressure within the body. The first one is the heart. Actually, when we measure blood pressure, there are two pressures that we measure. One is called the systolic pressure, is when the heart contracts, and the diastolic pressure is when the heart relaxes. In this process, the arteries, the brain, and the kidney play a big role on maintaining adequate blood pressure. When one of the forces overpowers the other one, we get high blood pressure or hypertension.
What is a number? Don't make it complex, make it simple. What number should we look for to say the patient is hypertensive?
Oh yeah, there are many, through the years, we have come up with different measurements, we call it, you know. Normal blood pressure usually, in overall, it should be a systolic pressure of 120 with diastolic pressure of about 80. When we exceed those pressures, like let's say over 130 in a systolic pressure, we say that the patient has high blood pressure.
Right.
And when we exceed the diastolic pressure, let's say that over 90, so we consider that also high blood pressure. Hypertension. So there are different degrees of hypertension.
So if the blood pressure is 130 over 90 and above, we could say high blood pressure, am I right?
That's correct, because when you exceed the diastolic pressure, it shouldn't be more than 90. So we call it hypertension as well.
Very good. How can someone prevent getting high blood pressure? What can you tell us?
Oh, absolutely. There are many things that we can do in order to prevent hypertension. Just to mention that hypertension is the second leading medical condition that affects the kidneys.
That's right.
See, my specialty is kidneys, and the kidneys plays a big role in controlling blood pressure. Actually, the most potent hormone that affects the blood pressure is produced in the kidneys. That's why in my specialty we see many patients or many people with high blood pressure.
So therefore, if the patient does not take care of the blood pressure, then they can have kidney complication, am I right?
Absolutely. Kidney failure, end up in dialysis, that treatment that when the kidneys don't work, so we have to go into a machine to clean the blood. That's hemodialysis. And hypertension, as I mentioned, is the second condition.
That will cause kidney failure.
That causes kidney failure, of course, after diabetes, which is number one.
Okay.
So the question, coming back to your question regarding preventing high blood pressure, I think there are many factors.
Let's go.
Yeah. One would be avoid stress.
Very good.
Yeah. Avoid stress. Person who is under stress, for whatever the reason, the blood pressure tends to go high. The other thing is obesity.
That's right. That's one of our #1 causes of hypertension.
Obesity causes many adverse conditions in the body. One is hypertension, diabetes, and some other peripheral vascular disease and so. But hypertension is very highly linked to hypertension. So obesity go hand in hand. Very
good. So then you'd advise the public to control stress, decrease weight, lower their salt intake.
Salt intake, very important. There's been some controversies on that, but I stick to the point that if we eat too much salt, the pressure go up because we tend to be thirsty and we drink more water and more water retention. And sometimes we can overpower the kidney function in retention of water.
Thank you so much, Dr. Levine. I know that we have much more to say on hypertension, but maybe in a future show. Thank you so much for joining us. And don't go away. We'll be right back with more information on high blood pressure. I want to thank my friend Dr. Levine for all the information that he has given to us today on high blood pressure. Remember, the emphasis of the show is to educate you on how to prevent, reverse, or get off medication if you're already hypertensive. So let's review some of the points that we mentioned about high blood pressure. So if you do not know your blood pressure, you haven't seen the doctor in a while, then go to your doctor and ask to be checked. If you don't have a doctor, go to the pharmacy. There are many pharmacies that have blood pressure machine. Go ahead and get the blood pressure reading, then take it to your doctor. What is the normal blood pressure? All right, it's a range. We mentioned that a good blood pressure to have would be about 120/80. For me, my blood pressure is 115 usually over 80. It's in the teen. The lower the blood pressure, the better it is for you. So if you have a blood pressure of, say, 90/60, you're not on medication, you're not dizzy, you're not vomiting, there's no diarrhea, then that's a good blood pressure to have. If your blood pressure is 135/85, then you are at risk. You are now pre-hypertensive. So you need to start making the changes to lower your blood pressure. So that's one. Get the number and work with your number. Number two, if you're overweight, if you have a BMI of, more than 30 and above, 28 and above, then you need to think of attaining a healthier weight. It is believed that lowering your weight by 7 to 10% could significantly affect your blood pressure. Now, as we mentioned earlier on in the show and in other shows, that obesity is a risk factor for many diseases: diabetes, cancer, lung disease, joint pain, and hypertension. So if you're overweight, then think of ways in which you want to change in order to lose weight. If you're a coffee drinker, caffeine is a stimulant and will increase your blood pressure. So you should try to reduce the consumption of coffee or discontinue the consumption totally. Alcohol. Alcohol is just a problem with many diseases. So if you're a regular drinker or someone who likes to consume alcohol, then start thinking of decreasing the intake. Now, your diet. Diet high in fat will lead to atherosclerosis. Atherosclerosis will cause plaquing and hardening of the vessels, the blood vessels. Remember, if the blood vessels are rigid and hardened, that will increase the blood pressure. So that is a problem. So think of what you're eating and make sure you're choosing food that have the ability to lower your blood pressure. We discussed the plant-based diet, and that is why the government have instituted what is called the DASH diet. Dietary approach to stopping hypertension. What is the DASH diet? Have you heard of the DASH diet? Well, it's a diet that is mostly plant-based with decreased dairy products. So now we know that in order then to decrease blood pressure, then your diet is very, very important. Stress. Stress is a huge problem with high blood pressure. So if you have a stressful job, then you need to think of ways to manage your stress. If you have stress at home, if you have financial stress, then you need to figure a way out to address and manage your stress, because managing the stress will lower the adrenaline, the hormones that will cause the blood pressure to be high. How else can you decrease high blood pressure? Of course, exercise. Exercise releases happy hormone, endorphins. Endorphins will cause general relaxation. Relaxation will then lower the blood pressure. So it is recommended that 30 minutes of moderate exercise daily or 6 days a week is regarded as medication, as medicine. So if you're inactive, you're going to increase your risk for many diseases: diabetes, obesity, cancer, and hypertension. Begin to exercise. And if you are unable to ambulate, to walk because of lower extremity problem, do upper body exercise or get resistant bands and use resistant bands and exercise. You have to keep your body in motion in order to be healthy. And if you're unable to exercise for any prolonged time, for 30 minutes, then do short exercises, but frequently. Okay, so do multiple 10 minutes, for example. Do 5 minutes, and then repeat that until you get your 30 minutes per day. But exercise is very important. And at this time, let's take a look at something, an exercise routine that you can do at your home in order to maintain good health. You know, we have been discussing how to control blood pressure, and one of the pearls is to exercise daily. At this time, we're going to join Christopher and Rebecca in our Living Active segment. Don't go away.
Thank you, Dr. Cooper. Welcome back to Living Active. My name is Rebecca Huerta. This is Christopher Hanna, and we'll be demonstrating 5 exercises that you can do in the comfort of your own home. Today's exercises will be focusing on the lower body workout. The first exercise is called a step up with a kick back. These are ankle weights are 5 pounds. They even have 2 to 3 pounds to see if you want to see how they feel at first. You can start with those. This is a box, but if you don't have a box, you can use just a chair, or you can just use a little step up, or maybe you have a bench on site, you can go ahead and step up on that as well. And what you want to do is when you step up, you push off with your heel, and with the other leg that you're kicking back, you want to go ahead and really squeeze at the top to make sure you're engaging your glute. You want to do about 3 sets to 15 reps on each leg. The next exercise we're going to go ahead and show you is called a Bulgarian split squat. What you're going to do is you're going to have your leg elevated. You can, if you don't have a box, you can use a chair as well. You're going to have one leg straight back, and you're going to do a lunge. You're going to go ahead and bend down, and this is working your quad area. When you bend down, you want to make sure that your knee is not really passing your toes. You don't want to get hurt. And you can do this with your body weight, or if you feel that it's a little too easy, you can go ahead and grab a dumbbell, or you can even, if you don't have any weights, maybe you can even grab a gallon of water, just something to make it a little bit more challenging. And this as well, you want to do 3 sets of 15 on each leg. The third exercise we're going to do is called the elevated bridge. You're going to go ahead and lay straight on your back. You're going to have one leg on top of an elevated surface. You're going to have the other leg straight up. And you're going to go ahead and push yourself off the leg that's elevated and lift yourself up. This is going to work out your legs, but especially your glute area. And when you lift yourself up, make sure you really squeeze your glutes. And you're going to do 3 sets of 15 on each leg. The next exercise we're going to do is Chris is going to take off his ankle weights, and he's going to do a side squat jump. It's like the basic squat jump, but except you're going to be moving from side to side. And you want to do 3 sets of 15 to 20. And just go ahead and keep jumping, and when you jump, make sure that if you feel any type of pain right here, just go ahead and just go into a regular squat. You don't want to go ahead and get hurt. The last exercise that we're going to be demonstrating is going to be a front and reverse lunge. That will be counted as 1 rep. You're going to go ahead and lunge forward, and you're going to lunge back with the same leg, and then you're going to go ahead and go to your next leg. And you're going to also do this for about 3 sets to 15 reps on each leg. So that completes today's lower body exercise. Make sure that you stretch and warm up properly. You don't want to get hurt. Like, you can warm up 5-minute jog in place and just stretch thoroughly before and after. Make sure you drink plenty of water and stay hydrated. Thank you. This is Living Active. Now back to Dr. Cooper in the studio.
Thank you so much, Christopher and Rebecca. We will be exercising this week daily. Thank you. All right, for some of you, you might think those routines might be difficult. But remember, whatever you can do, the most important thing is to keep your body in motion. Now, patients usually ask me, what is the best time to exercise? And I think it's dependent on you. When do you go to work? What time do you have? However, I do believe that exercise should be priority. And most times I'll tell the patient, then you should exercise first thing in the morning. Because when you do that in the morning, you're ensuring that the exercise gets done. Because a lot of time after work, one comes home and you're busy and there's just no time, or you might be tired and fatigued. So this is how I advise my patient, and I want you to do the same thing. When you get up in the morning, after you have had your devotion and your meditation, you drink 2 glasses of water, add some lemon to the water, make it alkalize in the water. Then you start with your stretches, warm-up exercise, and you get your 30 minutes, and that could be just brisk walking. After you have done your walk, then you cool down. And if you're unable to exercise, as I mentioned, I'll give you a story. A patient of mine, elderly man, about 70, not that elderly, he had heart disease and cardiac arrhythmia and heart failure. He also has hypertension and obesity and diabetes. This gentleman was in and out of the hospital. In less than a year, he was there 11 times. I remember going into the hospital, to the emergency room, and I said, Mr. So-and-so, I would like to release you from the hospital. I want you to come to the wellness center that I run here in South Texas, and I'm going to put you on an exercise program, a plant-based diet. He said to me, Dr. Cooper, I cannot get from my bed to my chair. I said, it doesn't matter. You come along and we'll work with you. After being in the program for maybe about 12 weeks, he moved from bed to chair, chair to walker, walker to cane, and then he was walking without the cane. He was doing so well that he was able to do just about everything, because exercise gives cardiac endurance. Remember, the heart is a muscle. If you don't use that muscle, then what happens? The muscle becomes weak and doesn't work well. So patients who are short of breath, patients who have cardiac problem, sometimes you need to get clearance from your doctor. But start with gradual exercise, and you're going to realize that you will have more endurance over time as you increase the muscle function. Now, if you're at work, say you're a secretary at work, and you can't find time to exercise, then stand. When you answer the phone, get up, stand with the phone and answer. Or just walk around, walk in place. I have a friend from Dallas, Dr. Bryce. He also promotes lifestyle medicine. And he says he gets up every hour and do at least a minute of exercise. And if you were to do that, you're going to be working the body, you're going to be add in your exercise. Because many patients will say, well, I don't have time to exercise, I just can't put it in. But if you work it into your lifestyle, make exercise a habit, then you won't have problem. You know, some people are getting now a standing desk. So you stand and use the computer. That's also a good thing to do. Or just walk around. I was in a conference the other day, and the doctor, her topic was exercise is medicine. And she was advising the students, now, if you're in class, then stand up. Stand in the periphery or stand at the back and move. She advocated to stand on one leg at a time. So stand on one leg, and then when you're tired, change to the next leg. The important thing is to put exercise in your daily routine. Those 30 minutes per day, those are very important. Because as we mentioned, exercise will improve your immune system and therefore help you fight off diseases. Exercise will also, as I say, increase the endorphin level, help to decrease stress. Exercise build muscle tone, muscle strength, muscle bulk. Exercise is good to build bone mass. So patients who have weak bone or osteoporosis, doing exercise, what we call weight-bearing exercise, walking or jogging, will increase the bone strength and therefore decrease fracture. Exercise has many functions, so don't hesitate to exercise. And exercise in the sun is important because vitamin D is important for good health. Also, the sunlight will will increase the production of nitric oxide. Nitric oxide is that chemical that is similar to nitroglycerin, will cause the blood vessels to dilate and therefore decreasing blood pressure and increasing blood flow to the vital organs. So sunlight is important. So exercising in the sun, say from 10 in the morning to somewhere at about 3 o'clock in the evening, that's the best time to get enough vitamin D in your skin. So exercise is medicine. Let me take the time to welcome all of my Facebook friends and those of you that are on YouTube. I have no time today to look at the names, but I know I have a lot of followers. I would like you to share the video, share and like the page. We want to empower many patients, many people to take control of their health. Too often, you know, physicians like myself and others will spend probably very little time to get to the root causes of diseases. And therefore, we tend to treat the symptoms. Treating the symptoms will not cure the problem. And that is why these programs are vital. So share the information. Learn it, practice, and then share with a friend. Can you imagine touching the life of someone else, helping someone who probably has undiagnosed hypertension to prevent a stroke, prevent sudden death, prevent kidney failure? It's very important. It's very important to know your body. It's very important to know your numbers. It's very important for you to learn what you can learn and share with your friends. Friends, we have a great physician, one who made our bodies. And Proverbs said that a merry heart is good medicine, but a broken spirit dries the bone. So if you're angry with someone today, think of forgiving that person, because forgiveness, the act of forgiveness, the act of love will actually indeed lower your blood pressure. The Bible also said, be anxious for nothing. Leave all your problems to the Creator. Seek help. If you don't have a church community, find one, because studies have shown that people who attend church regularly tend to have less medical problem or will control their problem better. So therefore, find a church community, because that will help you on your journey to good health. Friends, please send questions. Questions are very important. Send me information. Tell me about topics that you'd like me to discuss, because I'm here to help you. I'm here to empower you. I am here to help you on your journey to amazing health and longevity. So until then, I'll see you next time, same station. Until then, enjoy good health.